Good morning, everyone. I'm Jeff Say, President and CEO of the Culpeper Chamber of Commerce, and welcome to our 2021 State of the Community. This past year has been daunting, to say the least. About a year ago, we hunkered down for what we originally thought might be a couple of weeks, socially distancing ourselves to protect our community. A few weeks turned into a few months. While our emotions ran the gamut from hopeful to anxious to frustrated and then acceptance that we are living in a new normal. Through all of this, we at the Culpeper Chamber of Commerce have strived to help promote economic development, education, and togetherness. Today's State of the Community is our second virtual version of the event, following the success of our 2020 virtual State of the Community last May. The Culpeper Chamber of Commerce has worked hard to continue to inform our public about loans, grants, and other programs that have supported our businesses and nonprofits during this pandemic. It has always been our mission to connect the community, but that was heightened when we were all separated by social distance guidelines. We have found creative ways through virtual town halls, hybrid events, and our community partnerships with Culpeper Media Network, Culpeper Town Tourism and Economic Development, Culpeper Renaissance Inc., Culpeper County Economic Development, and many more. Emotions have been heightened as we've never felt more alone, but I assure you that Culpeper is stronger together. We will come out of this pandemic only through a united front, one that works for the betterment of our community. I've seen moments of hope, and these presentations today will likely elicit that same reaction from you. I want to thank our sponsors, Bingham & Taylor, Culpeper Star Exponent, NextEra Energy Resources, and WinStar Technologies. Thanks to these sponsors, we will continue to educate and connect our community. We start off today's program with a report from Paige Reed, Director of Tourism and Economic Development. During the pandemic, Paige has worked closely with town and county businesses through several grant programs, most notably Culpeper Cares and Culpeper Recovers. She will share today about Culpeper's economic future. Paige, thank you for joining us.
Thank you, Jeff. Good morning, everyone. It's an honor to be here. Jeff said it best. It's been one hell of a year, and I consider myself extremely fortunate to be a part of the Culpeper community. The world fell apart, but we banded together. Okay, so let's talk the state of economic development and growth in Culpeper. There are a lot of ways to define economic development. For me, it's all about encouraging, stimulating, and supporting development and expansion of our local economy. To accomplish these objectives, economic developers have historically focused on business recruitment, expansion, and trade. This is where I differ a bit. I feel a more holistic community development approach yields stronger results. I feel it's imperative to account for residential behavior, consumer behavior, and tourism behavior when pursuing economic development, growth, and sustainability. So how do we work towards accomplishing these goals in Culpeper? To start, we begin at the state level. The Commonwealth is extremely competitive. In fact, CNBC recently ranked Virginia #1 in workforce. Smart Asset ranked us second in regards to higher education in 2020. CyberStates ranked Virginia #2 for the highest concentration of technology workers in any state of the country. Virginia also has the 4th largest veteran workforce in America. But by far, my favorite Virginia ranking is from Forbes, who recently ranked Virginia the #1 state for quality of life in the US. Virginia has the 2nd densest interstate system in the Southeast. We will have the deepest and widest port on the East Coast by 2024. We have over 3,000 miles of railway, plus 2 Class 1 railroads. Virginia has over 100 domestic destinations by air and over 50 international destinations by air. Virginia also has over 2,300 current available sites and buildings ready for economic development investment. So that's the state level. Let's drop down to the regional level. It gets a little tricky here. So Virginia Economic Development Partnership has Culpeper as part of Region 8, but then Go Virginia, which is a statewide initiative focused on improving our economic position under the Department of Housing and Community Development, has Culpeper as part of Region 9. Regardless of which distinction you work off of, as a region, we have identified the following priority industry clusters for economic development growth: light manufacturing, biotechnology and biomedicine, food and beverage manufacturing, IT and communications, and financial and business services. As a region, we, myself and my counterparts, we work within 4 framework categories: talent development, growing existing businesses, scale ups, site readiness, and startup innovation and commercialization. And Culpeper varies in strength within these frameworks and within our region's priority industry clusters. At the local level, within our community, Culpeper is very strong in entrepreneurship. We have over 800 registered businesses within the town alone, which is home to roughly 18,342 citizens. By workforce, Culpeper's sector strengths are government, federal, state, regional, and local levels, commercialization and retail, healthcare and social assistance, manufacturing, construction, and professional, scientific, and technical services. By employee size, Culpeper's largest employers include our public school system, the Novant Health UVA Culpeper Hospital, county and town government, SWIFT, a financial banking institution, Cintas, a business services company, state government agencies such as VDOT, the Gretna Health and Rehabilitation Center, Continental Automotive, which is manufacturing, Masco Builder or Merillat Cabinetry, Lowe's, Walmart, Target, etc. And by land use, Culpeper's sector strengths are agriculture and commercialization and retail. And that really kind of feeds that within our immediate region, Culpeper and the localities directly connected to us, Madison, Orange, Fauquier, Rappahannock, and touches of Spotsylvania and Stafford, Culpeper is the established central services district. We pull consumers from all locales. We are also a huge tourism destination. Tourism represents $45.7 million in domestic visitor spending. In other words, in 2019, visitors spent an average of $125,226 per day in Culpeper. In 2019, tourism generated $1,023,379 in local taxes. Why is this great? Because tourism revenue is argumentatively more valuable than local revenue. That's right, I said it. Tourists come to Culpeper, they spend money, and they go home happy, which means they do not burden our school systems, they do not burden our healthcare systems, and they have minimal impact on our roads and local infrastructure, which is why we just love tourism revenue. And as an industry, tourism can be broken down into roughly 10 categories: town city centers, nature and outdoor recreation, history and heritage, meetings, sports, culinary, arts and music, industry, commercial attractions, and events. Culpeper's category strengths are obvious: towns and city centers, hello Davis Street; culinary, hello Davis Street; history and heritage in every corner of our community. And over the past few years, we've been growing our strengths in nature and outdoor recreation, events, and industry. Think agritourism. As mentioned earlier, tourism, residential, and consumer behavior are a critical component of economic development. It has been over a year since the pandemic struck home. This past year has taught us a lot. In some areas we've gained, and in others we've lost. One of the biggest losses to me, besides the most obvious, human life, is the loss of predictive modeling. It's not really 100% gone, but most economic models, industry models, are derived from decades of consistency in data and behavior, which COVID has completely disrupted. I've been watching, reading, and reviewing the changes in consumer behavior over the past 12 months, and some of the biggest changes include, which most likely will not be new news to you, that consumers have become more and more mindful of discretionary spending. The most recent reports from Oxford Economics are showing that personal disposable income is not expected to recover to pre-crisis levels until the second quarter of 2024. It's alarming. Loyalty, this one's huge, has completely been disrupted. It's upended. During the pandemic, 76% of consumers have reported trying new brands and or sources of purchasing, citing convenience and better value as the primary drivers of their change in behavior. And of this 76%, over half report that they intend to continue this changed behavior moving forward. So that's pretty big, and that is going to result in a lot of changes in how we reach our audience. Remote work has resulted in the rapid and prolonged decline on-the-go consumption. And even with the distribution of the vaccine, we are still very much living in a homebody economy, with only 37% of Americans engaging in normal out-of-home activities. Play, entertainment, learning have all integrated with life at home, where a home has been recast as the new coffee shop, restaurant, school, and entertainment center. And this coincides with the further migration to all omni-channel digital. Example, Disney Plus achieved in 5 months what took 7 years for Netflix. And many of these trends that we are seeing are accelerations of past behavior. We've basically covered a decade in days when it comes to the adoption of digital. Some positive changes over the past year have really included an increase in health and well-being. We're seeing an acceleration of organic, natural, and fresh food consumption. Monthly, year-over-year growth of organic produce in the US increased 10 times this month compared to just last month and February alone. Fitness on demand has emerged and capitalized market share, and e-pharmacy and e-doctor appointments are on the rise. I myself have already had 2 e-doctor appointments, including one for my children, which is just bonkers to me. So e-commerce, which was a trend prior to COVID, continues to break records. The most recent volume metric is 10 years and 8 weeks. That means that we have had 10 years worth of deliveries from online shopping in 8 weeks. Whew, it's a lot of boxes. These are just a few big changes, and for the most part, these behaviors will continue to see a linear development trend or stick in the next normal. Behavior changes will reshape consumer decision journeys, and companies will need to adapt fast. 2021 is quickly becoming the year of renewal and reconnection. Time with family, time with friends, simple joys will be driving consumer behavior. It is my belief that moving forward, consumers will be more intentional with how they spend their time and money, more conscientious with company selections, brands, and product choices. This coincides with the resurgence of stakeholder capitalism versus shareholder capitalism. People want to support businesses and organizations that demonstrate respectful behaviors to all people and the planet, not just profit. So this means our businesses are going to force to continuously pivot and to remain flexible. They need to pay attention to shifts from day to day, month to month, not only year to year anymore. And with the flight to digital, they need to consider how they're reaching their audience. Think about the rise of voice search and voice control. Today, consumers are asking Alexa, best donut, 22701. We all know this answer, it's Knackles. But for this to happen, businesses need to structure their website content properly so it appears in voice search and allows for voice orderings and bookings. Simply put, everything is changing, and it's changing at a rapid speed. So where does this leave Culpeper? In 2020, Culpeper accomplished a lot. Some of the 2020 accomplishments and the ongoing 2021 projects include, of course, our Culpeper Cares grant, where we invested over $3 million of Federal CARES Act money back into our small business economy, the ongoing Culpeper Recovers grant, where we are bringing an additional $800,000 to the small business community. We opened the micro marketing leverage grant to assist our businesses with marketing and advertising efforts. We invested in the downtown parklet program, creating a more vibrant community, offering safe outdoor space for consumer consumption. The town's completed a handful of infrastructure projects, keeping our community safe and attractive, sidewalk improvements at Blue Ridge Avenue, East Davis Street, paving and road improvements throughout. We're investing in the continued growth of our parks with the addition of the Young Children's Playground at Rockwater. Construction actually just completed 2 days ago. I'd like to thank Culpeper Wellness Foundation for their financial support on that project. We're making tremendous project. I don't know if you guys have seen the progress that's being made on the site across from the railroad tracks, across from the depot, where the town will be investing in a new parking lot with a pedestrian bridge over the railroad. And this project is really enabling us to work more closely with developers for infill projects in the downtown in an effort to meet market demand for residential and experiential consumer commercial development. So we're really excited about some of the projects on the horizon. We're prepping a future site out near the Lake Pelham Dam for a future park in years to come. And we have roughly 5 major roadway improvement projects in the works with VDOT. We're also currently running our Culpeper Competes Entrepreneur Education Competition Program. We are in week 6 of that program right now, and competition will be held on April 13th. So other positives in our community over this past year and into this year include Culpeper Wellness Foundation's new 18,000 square foot recreation center in conjunction with the renovation of their existing 12,000 square foot center off of Lovers Lane, the new field house that the county is building out at the sports complex, and all the work that Andrew Hardy's team is doing with Parks and Rec, the opening of the Culpeper CTE school coming this fall. I know it's highly anticipated, and I believe students are already starting to identify what tracks and what courses they want to take there. So that's tremendous for our youth future and our education locally. And I also know that John and team will talk about that later today. Some private investment recently, the opening of Death Ridge Brewery, the expansion of Old House and their upcoming full service on-site restaurant, the expansion of Mountain Run Winery and their new tasting room and event venue. Plus we have a new winery joining the community this summer down Route 15. And we are also extremely impressed with the continuity of small business operations throughout this pandemic. Compared to pre-pandemic years, the 2020 small business attrition rate for the town of Culpeper is less than 2% off. This is remarkable. With the American Rescue Plan stimulus on our doorstep, I took some time to calculate the value of the federal CARES stimulus money from last year. And businesses and organizations have received over $76 million in Culpeper. Some is grant money, some is loans, so a portion of that will have to be paid back. This amount only accounts for the direct federal stimulus money that reached our businesses. It doesn't account for all the nonprofit and the private grant money that has also supported our community. Culpeper is very fortunate, and it should really feel extremely grateful for the volume of financial support that we have received this past year. So what's on the horizon? Again, economic development, it's target sectors, it's residential behavior, it's consumer behavior, it's tourism behavior. You really have to look at all of those components. And when you look at Culpeper and our growth trajectory, one of the easiest ways to mark that is with residential and population growth predictions. So the US Census Bureau reports a projected growth rate for Culpeper of roughly 30% for the next 20 years. That sounds really alarming. So let's put it in real numbers. Currently, our county population is roughly 52,605 people. And the US Census projection will take us to roughly 70,000 people by the year 2040. This is kind of hand in hand with what the University of Virginia, the Weldon Cooper Center is reporting, where they're saying by the year 2030, the town is going to be home to roughly 22,000 and the county will be home to just over 61,000. And then by the year 2040, the town will grow to 25,000 and the county will grow to 70,000. So last year, the town of Culpeper was the 5th largest small town in Virginia. And then here's the big macro. And in less than 20 years, by the year 2040, half the US population is going to live in 8 states: California, Texas, Florida, New York, Pennsylvania, Illinois, Georgia, and North Carolina. And so yes, Virginia is not in the top 8, but we do fall in the next top 8, which will account for an additional 20% of the US population. So the next 8, Arizona, New Jersey, us, Virginia, Massachusetts, Washington, Michigan, Colorado, and Ohio. The math is simple. By the year 2040, roughly 70% of the American population is going to live in 16 states. And Virginia is currently listed as number 11. Now, all of this data was pre-pandemic predictive data, so I think that there could be a shakeup on how that plays out, but not so large of a shakeup that I think we're going to fall off that top, 15, top 16 states. And this growth rate means a lot. Virginia's projected growth rate as a state for the next 20 years is only 6.86%, whereas Culpeper's projected growth rate for the next 20 years is 13.81%, more than double the state growth rate average. So what does this mean? It means our community is growing, and with it comes opportunity to improve our economy and to improve the quality of life and work-life balance to attract sustained investment and economic development. And how are we going to do this? Well, we can do it by continuing to work with our existing industry partners, to work within our region or in our region's target sectors, with our state and national partners. We will continue to engage and help move our greenfield sites towards investment and development. As you remember, Virginia currently has over 2,300 different sites and buildings available today for investment. And here in Culpeper, we don't have a lot of vacancy, not at a large scale, but we do have some developable land. And some of that land needs to go through different zoning processes, and infrastructure needs to be brought to site to make that land more viable for industrial growth. And when I say industrial growth, I don't want to scare you. It doesn't mean we're going to have massive factories popping up. I mean, we could. That is one potential with manufacturing, especially in the food and beverage manufacturing industry, which is a target sector for us. But it'll all be sustained and it'll be done at a scalable level. So these are positive things for our community. It brings new revenue, it brings new investment in, and it really helps us leverage our strengths. We need to help our tourism economy rebound in the coming years because they have had prolonged injury due to the pandemic. We also need to continue to reinvest in our community in ways that attract workforce and families to move here and to become a part of our community. You know, pre-pandemic, one of the trends for the past decade has really been businesses moving to where workforce is versus people moving to where jobs are. You know, Culpeper, we have over 60% people commuting out, but now with the homebody and the remote work on the rise, and with the continuation of remote work, I think we're going to have an opportunity to really see a big shift in our workforce and in the broad range of talent within our community, and what that's going to mean for business development and growth within our community. And so the more we make our community an attractive place to live, a place where the quality of life is high, you know, Virginia's ranking #1, let's get Culpeper to rank #1 within Virginia. You know, if we can do that, we can really attract that talent in home. And from that comes innovation, comes growth, comes sustained local economy. And so there's just so many different approaches to our economic development and our growth for our community. And I get really excited about a lot of it. I love the data. I love the partners, partners like the Chamber, partners within our region, and our existing industry. So, you know, it's really kind of monitoring and keeping an eye on things and providing support and being able to shift quickly to bring that support to those partners when needed in a rapid speed, because this next 1 to 2 years is really going to continue to shake out post-pandemic, and a lot will be learned. It's going to be an interesting case study. So thank you for your time, and that's it.
Awesome. Thank you, Paige. As always, wonderful information. And I thank you for all the work that you've done. And I love the theme that you said was reconnecting. And that's something that we're really focusing on here, is reconnecting our community. And our Women's Lift program on May 5th, that is their theme. And so it's really important for us to bring, especially the women together, but our entire community together. So thank you, Paige, for bringing that up. I think that's a great theme for this year. Health has been at the forefront of the community conversation as the pandemic forced us to take a look at our health infrastructure, learn what COVID-19 meant, what prevention tactics we could take, and now being educated about vaccinations. Donna Staten, president of Novant Health UVA Health System, Culpeper Medical Center, will inform us about state of healthcare in the community. Donna, thank you for joining us today.
Good morning, Jeff. Thank you. And thank you to everyone that's able to be with us virtually this morning. I think virtual is probably here to stay. I think as Paige alluded to, the acceleration of e-commerce, of what we've seen in terms of what would have taken 10 years, we've probably seen the same type of thing in terms of the transformation with healthcare. And so this morning, I really just wanted to give you a little bit of an overview of some of the work that's been going on and a little bit of a forecast in terms of where we think our time will be spent through the remainder of the year. So let me share my screen and we'll get started. All right, so certainly COVID has been all-consuming. Interestingly, in the last 2 weeks, we hit the 1-year anniversary of when the World Health Organization established the state of the pandemic across the nation. And so as such, our work has been exclusively really focused on how do we respond to COVID in terms of daily operations and ensuring that our team members and our patients' safety is our top priority. So I thought this was interesting to start out with in terms of where we started and what we've seen, and hopefully the trajectory that we continue to perform on. So as we started out with the pandemic back in March of last year, we anticipated this tsunami event, which really didn't occur. It was certainly what we thought to be the new norm, but we were just starting to kind of warm up with the expectation of surges that would come as a result of the quick spread of the virus. So what you'll see back in April of 2020 was a small peak of about 1,500 hospitalizations. And then, as we know, as the community and the Commonwealth really went into lockdown mode, the lagging indicators for the spread of COVID typically ran about 3 to 4 weeks behind the community testing positive. So we saw a huge dip as we went into this lockdown mode with complete restrictions on travel, as well as mandatory masking, and really some of the executive orders that went into effect to limit the amount of gatherings. We saw a slight uptick as people started to, I think, really go through the grieving process. That's probably the best analogy that I could think of in terms of our acceptance and toleration of COVID, is that it was very similar to that of grieving, and that we first went through denial, and then we went through anger, and then we went through acceptance. And I don't know about you, but I think I went through 2 or 3 cycles of that alone as I went through this past year. And then we saw really kind of a stabilization as we moved into the fall, a little bit of an uptick as we saw the schools go back into session. And then certainly this tsunami event that we all anticipated would occur happened in the December timeframe, following the Thanksgiving holiday, as well as the Christmas holiday and New Year's. And so where are we at today? So the good news is that during the course of this 10 to 12 months, we've done, I think, a phenomenal job as an organization and as an industry, stabilizing our supply chain, making sure that protocols were in place to ensure masking. We locked down our facilities to make sure that visitors would only come in on the most extreme circumstances. Every entrance within the facility, we instituted tight screening protocols. And so mandatory masking, hand washing, as the health department has continued to promote, it works. So today our hospitalizations are down to pre-surge levels, down over 65%. And our service area that comprises Novant Health UVA, we see that we are down 80% overall from an all-time high, which was back in early January. And January 8th, we had seen 336 hospitalizations, 75 of those being in our ICU. And then March 23rd, we were down to 66. So some significant reduction in overall hospitalizations. I'm happy to report that at Culpeper Medical Center, we track very closely our percent positive rate of COVID patients that come in through our emergency department. And we are down now at the lowest percentage that we have been almost since the beginning of COVID. And that is at 8.5%. As Culpeper Medical Center, specifically as a community, you'll see the number of case counts as we ramped up some of our testing efforts early back in May. Again, this similar trajectory shows a stabilization through the summer months. We see this one big uptick of 173 cases back in November. That was with one of our correctional facility centers having a large outbreak of COVID in our community. And we'll see the bed demand, which is the line in yellow, really mirrors that. And as you can see, follows that about 7 to 10 days in terms of the number of hospitalizations required. So we are trending downward, which is a really great thing. This reflects our total COVID admissions that we've seen since the beginning of the pandemic. And this is on a month-to-month count. So you can see back in December, our system was really taxed. And it really was an extraordinary sight to behold on behalf of our hospital employees. We saw over 72 admissions in December and going into January. At some points, our overall daily census was in excess of 50% of COVID positive patients. The good news is that we had not one single team member acquire COVID through the process of caring for patients that were COVID positive. We have robust tracing protocols in place for all of our team members that did acquire COVID. And through that tracing, we recognized that it was all community spread. So the fact that our infection protocols, our masking, our guidelines that we adhere to very, very closely, they were very effective and continue to work. And so today, in the month of March, we've seen 11 admissions to date. We are averaging right now between 3 and 4 admissions within the facility on a daily basis. And incidentally, those patients are here for other reasons other than COVID, which is a really good thing. So this just demonstrates that the acuity of COVID is going down. The prevalence in the community is going down. And so patients, we have mandatory testing of all patients before they receive any form of outpatient surgery or delivery. And so oftentimes we see and treat patients that come in with an incidental finding of COVID that may not have any acute symptoms. So as we think about COVID and as we think about the vaccination efforts that continue to ramp up, we've heard a lot of talk in the industry about variants and how concerning are variants, and is this state of existence going to continue for the foreseeable future, or have we begun to turn a corner with vaccinations efforts continuing to ramp up? What I would like to share with you, and this is a slide that I pulled from our Chief Medical Officer presentation, is that our vaccines continue to demonstrate extreme effectiveness in preventing severe illness, even across the variants. So while we see the variants continue to take hold out in the communities, what we do find is that our 3 different forms of vaccines today, which is Moderna, Pfizer, and the new J&J vaccine, they are effective in reducing severe onset of symptoms, severe illness, and this is why we continue to vaccinate at an increasing rate. So from an overall community standpoint, I just have to say that I could not be more proud to be a member of this community, and the tremendous amount of collaboration and partnership that I have seen starting back at the beginning of this calendar year. So just to give you a little bit of a timeline perspective, we received our first vaccine in early December from the CDC. We offered this exclusively to frontline healthcare workers starting on December the 7th. 3 weeks later, we actually began to offer second dose administrations to our employees. The health department began to stabilize their operations towards the end of December, and beginning in early January, our health department began to roll out vaccine efforts in a small scale at Riva Fire Department, really to validate how they could get the logistics right. The sign-up process, it definitely has lots of complexity when you think about outreach and having to schedule appointments for every community member. Later at the end of January, the health departments at the direction at the state level began to pull back on vaccine allocation directly to hospitals and began to allocate those exclusively through their health department channels. And so as such, we began to partner directly with our local health department for community vaccine offerings. I could not be more proud of the work that's been done with our community partners across Culpeper Middle School, Culpeper Emergency Services, as well as many, many numerous other entities in Culpeper as well as Madison. And since the beginning of January, really, we began to offer weekly clinics at our Culpeper Middle School, as well as at Madison Fire Department to include first and second doses. Meanwhile, in parallel, the health district continued to provide clinics 4 days a week at Germanna Daniel Technology Center. And then on March the 6th, we received our first massive dose allocation of the single dose J&J vaccine, which I believe was really a test at the state level to see how the state would perform with an allocation of over 69,000 doses of J&J that got spread across the Commonwealth. We received within our small health district, which supports 5 counties, a little over 2,000 doses, and we rose to the occasion and did a stellar job in just a very short window of time, had a mass clinic at our Culpeper Middle School and administered close to 1,000 doses of the J&J single dose vaccine. Community partnerships certainly are the foundation of our vaccination efforts and will continue to be that solid foundation on which we build. So as we think about moving into the spring and into the summer, hopefully you saw the announcement earlier this week that we are now in phase 1C of our administration and vaccination efforts. We expect to be in phase 1C for probably about 2 or 3 weeks, and then we'll go to a broader application and opening that up for appointment signups. So our partnerships with our community stakeholders continues to be the foundation on how we will push this vaccination efforts out into the community. And I'm happy to report, and I know Dr. Tony Brads is on the line, that we could not have done this without the partnership with our local Culpeper County Public Schools. Every Wednesday, we have countless volunteers that are at the middle school, our school nurses that are providing weekly support and have just been instrumental in helping us administer well over 15,000 doses into the community so far. So pivoting a little bit as we think about what does 2021 hold and where do we continue to focus, I did want to share with you, we worked very deliberately in 2020 on a strategic plan and a goal for our community that we continue to execute and deliver on. So first and foremost, we want to make sure that we continue to provide access to our patients locally here in our community. We will also want to make sure that we are enhancing and growing our key service lines with the goal of keeping care local. Our care should be affordable and meet our communities where they need it. We also want to be able to continue to provide sustainable services for our communities through our community outreach. And then an integrated health system is our ultimate goal with our 2 hospitals in the north, and now with our UVA announcement. I'll speak more to that in a few moments. And then integration and diversity and serving our community locally is our #1 priority. So as we think about how we do that, wanted to share with you just very briefly, as we look at how we partner out in the community, we partnered with our local PATH Foundation in 2020 to conduct a community health needs assessment. And so this is a 3-year plan that will continue to look at how we push benefit out into the community. And our focus areas as part of Novant Health UVA Health System is to focus on 2 areas: behavioral health, which includes mental health and substance abuse, as well as obesity and wellness. And through these different imperatives, we will really be focusing on education and how we can continue to provide resources through our community partners and through our channel offerings for mental health education, prescription drug intervention, as well as education and screenings that promote wellness. As we continue to work on this journey, it is a marathon and not a sprint. It takes a long time to change lifestyle, to change behaviors. And so we believe that that oftentimes starts with our youth. So you'll see an increased focus on education to our younger adult population, as well as partnering with many of our non-for-profits here in the community continue to promote education and awareness. This is a 3-year journey that we look at these imperatives. So you'll see this work actually kicked off in January of this year and will carry us through 2023. And we will be working closely with community partners like the Art of Aging, as well as some of our local non-for-profits and the Community Service Board to continue to partner to make sure that these efforts are far-reaching into our community. So you'll see some of the work that's been done so far. We provide charitable contributions to a number of community partners, including Aging Together, SAFE, our local Culpeper Wellness Foundation, and then Piedmont Crush. We also have a lot of communication and education that is going out right now, geared specifically at our underserved populations and to reach our health equity segments around COVID-19, the safety of our vaccines, as well as mental health seminars for our 55 plus community. In partnership with Dr. Karen O'Brien, who is the administrator of our behavioral health inpatient unit at Prince William Hospital. We have a drug take back day scheduled in partnership with our local Piedmont Crush organization. That is a recurring take back effort that goes into effect on both in April and October. And then from an obesity and wellness standpoint, we continue to focus on how we can partner with local wellness foundation, as well as provide education out into the community for the advantages of wellness and education. So you'll see just a few of those highlighted here in terms of work that we've done so far just through the end of February. And then 2021 and beyond. So hopefully everyone saw the announcement that was pushed out in the middle of February regarding our UVA health ownership transition, currently targeted for the beginning of July. We're very, very excited about this announcement and what this will mean for our local Culpeper community. How we can continue to leverage our UVA brand and access to subspecialty care that will be expanded into our local community, as well as reaching into the northern parts of our service area in Prince William and Haymarket, and how we continue to take the work that UVA has done here in Culpeper and build upon that and continue to expand into our northern parts of our market. Our vaccination efforts are, as I mentioned earlier, occurring weekly. Vaccination supply will continue to ramp up. And as such, we will continue to expand our efforts through our weekly vaccine clinics and our local community partners to make sure that we are pushing out as much vaccine as possible on a weekly basis. With the pandemic, we saw virtual visits accelerate in adoption. And while we've seen some softening of utilization of those, I am here to tell you that virtual visits are here to stay. We really want to continue to build upon those as a way to improve access to care. Similar to Paige, I actually had a telehealth visit with my pediatrician just this past week. So I think ease of access, as team members and community members are working remotely, this will continue to be a great option to improve access to care. And we will be offering more and more telehealth options, I believe, going forward for access of UVA subspecialists. We also continue to grow our medical staff to meet our community needs with a focus on keeping care local. Continued growth in orthopedics, our women's services, and cardiology are just three of the areas that we have additional recruitment and expansion of services targeted for this year. And then reinvestment of capital and facility improvements. We have some great, exciting projects that are already underway and will be online before the end of this calendar year, including enhancements in our family birthing center to support double-digit growth in deliveries and births that we've seen just in the last 2 years. We also will be investing pretty heavily in our cancer services program. We will be putting in place a brand new linear accelerator that supports our radiation therapy services. And then beginning on April the 9th, we will begin offering mobile PET CT services at our Culpeper campus, which currently patients must travel into Charlottesville for those services. So again, I think healthcare is a core part of our infrastructure. We continue to see our community voting for us and really looking to come and keep care local, seeking to access services here at Culpeper Medical Center. We're happy to promote and share with you our quality grade A rating by Leapfrog organization, and then just continuing to build upon, I think, the great work that has been done over the last several years, and reinvesting in our services and community offering, to be able to have patients choose us for their health care. So with that, I will pause and see if there are any questions.
Donna, thank you so much. Greatly appreciated. And from our office and our community, we want to say thank you to all of our healthcare providers and employees, because you guys have really put our community at the forefront, and you've worked so hard, and it is noticed, it is appreciated, and we love you guys, and thank you so much for keeping us healthy and safe during this pandemic. We greatly appreciate it. And it has not gone unnoticed, as I said. Thank you. Moving forward, our Volunteer Fire and Rescue Association has faced numerous challenges during the pandemic. Increased calls, reduced volunteers, and the loss of critical fundraisers have been issues the volunteer organization has faced in the past year. Through it, these brave men and women have continued to serve our community. When we rush out, they rush in. Rushing in to tell us more about the state of public safety in Culpeper is Charles Jr. Perryman, president of the Culpeper County Volunteer Fire and Rescue Association. Junior, thank you for joining us today.
Good morning, Jeff. Thanks for having us. It's a pleasure to be here and tell you a little bit about the Fire and Rescue Association. Just check in. Can you see my slides? Just want to be before we get too far.
Yes, sir. We're all good. Right ahead.
How's that? All right. So a little bit of an agenda. It looks long, but we'll cover it in 15 minutes or less. So a little bit about an introduction, our background, our volunteers in action. I'll tell you a little bit about the Fire and Rescue Association and our member companies. We'll talk a little bit about the value that our volunteers are adding to the community. We'll look at our call rates, the cost of delivering our services, some training statistics, volunteer demographics. I think that's kind of key. We're trying to make sure that we're all inclusive, and we certainly want to pull in the younger generation. The work that we do is extremely hard, and it takes strong backs, strong minds to do what we do day in and day out. So a little bit about, here we go. So here, the lower three triangles, I kind of want to highlight that without those three, we can't do the top triangle. Fundraising has been a tremendous challenge over the past year with COVID. Basically, it's almost non-existent because most of our fundraising activities were surrounded around bingo, which, we have excess of 100 or 200 people in certain sites. So that's been canceled for 9 months of 2020. Our training has been adapting as well, from hands-on with a little bit more remote learning. A lot of our meetings are also virtual, just like everyone else is talking about. And our members are still strong, while a lot of the communities around us are falling by the wayside with volunteers. We see it time and time again where a lot of the communities around us are going to either a combination company, which means partly or mostly career staff, and then they're supplemented by volunteers to help reduce the burden on the tax base. And even with all of that, we couldn't do all this without our community support. And Culpeper has always supported volunteers, fire and EMS across the board. Recruitment and retention, as I mentioned, where we're continually looking at how can we bring in new volunteers. All of us are doing this with no pay. I guess the biggest thing we may receive is a free T-shirt, which we wear proudly, showing our loyalty to our departments and to our community and volunteering. And of course, I believe, excuse me, I believe we have strong leadership across the board in all our departments. which again, as the president of the association, helps me sleep at night to be sure that everything is running smoothly. A little bit about the mission and the board composition. Our primary focus as the Fire and Rescue Association is to promote a cooperative relationship across all 8 companies. We are truly 8 individual companies, but when the alarm sounds, we have to come together and work together. We have to have standards that we go by, procedures that we follow, so that we're all on the same page. Of course, we're continuing to look at how we can enhance our services across the board. And we also act as a liaison between the volunteers and Culpeper County. We work closely with the county government. They do fund us with operational expense and CIP. So we're often having meetings with them. Our board of directors consists of 1 voting member from each department, and we have a president, which is me. We're vice president, secretary, treasurer, and we also have 4 directors making up the 8 individuals on the board. We also have working committees, standing committees, which is an administrative committee, budget and finance, communications, recruitment and retention, EMS, and fire. It's a big business to be volunteer. We have a tremendous amount of assets that the volunteers own and operate. And here a little bit about that is each individual company. Again, we can't do it by ourselves as one individual company. We rely on each other on a lot of the major incidents. And here we kind of spread around specialty pieces so that not one service or one department is relied upon to deliver the service. So for Culpeper, we do have an aerial device which is able to reach out, say for water rescue or for fires or reaching high elevations up to about 100 feet. Brandy Station has a gator which supports getting hunters out of the woods who may have been injured or brush fires, those types of things. Richardsville, who is on the river, they have a boat and they're often called upon, especially during the pretty weather. Brandy also has a ice water rescue team, and they work in conjunction with Company 6. Salem has a canteen, which is really appreciated when we're out 8-10 hours on an incident or we're spending an entire day training. We do have the facility to provide some refreshments and drinks and coffee and things like that. Company 9 has a large animal rescue, which is it is the only volunteer organization in the state that has a large animal rescue. They also are called on several times a month to assist with horses and cattle, getting them up, assisting veterinarians and things like that. Company 10, which is Rapidan, has a light and air unit. So at nighttime when we need extra light to light up the scene, we call upon them. And of course, when we're breathing lots of bottled air on an incident, they have a cascade system which is able to refill our air packs or air bottles on the scene. Company 11 currently has no specialty piece. However, the number of calls that they run, they're really taxed, and we'll share that information as well. But they do a tremendous job answering EMS calls. And then Riva, we also have a mass casualty trailer, which is something we hope we don't have to use often, but it is there. It's stocked with backboards and supplies that in the case of, say, an overturned bus or other horrible type situations of active shooters, things like that, it is a piece that is readily available to our resources. So this here brings back good memories, volunteering in our community. This was pre-COVID. This was National Night Out. We were all over the county with law enforcement, our partners, displaying our equipment. The community really loves to come up and see the fire trucks and ambulances. This was every year this event has gotten better, and we certainly look forward to reestablishing that and attending with our law enforcement partners. So I was talking about calls for help. The volunteers, if we look here, I'm kind of focusing now more on the totals. Back in 2017, we saw 6,600 calls. As you can see, each year, we have continued to increase our number of calls. Last year, we were down a bit. I do attribute that to COVID a bit. A lot more people were at home, less travel. So I think that did play a little bit into the down, to the decrease in the number of calls that we were receiving last year. Still a lot for a small, sleepy town. 7,100 times volunteers responded to some type of an emergency in the community. I talked a little bit about this is an expensive proposition, providing fire and EMS services to the community. The county awards us $400,000 a year in CIP money, and that money goes towards buildings and some new purchases of equipment. And I'll talk a little bit about that. We are reimbursed 100% for operational expenses. That's another $1.9 million that goes back into the volunteers' needs. And with that, I also want to share that we are also doing our part. Dollars back into the system raised by the volunteers. Typically in a good year or in past years, we've raised ourselves about $900,000, just shy of $1 million of money that we reinvest into new equipment, into our buildings, into all types of things to keep our fleets up to speed and safe. And then we also are able to collect some EMS recovery money by transporting patients that the county soft bills. So the insurance companies are reimbursing our services, but that money goes back into the county fund. So if the volunteers go away, the last box at the bottom, if we were to go away, something I've shared with John is that our buildings are okay for now, but they will certainly need some upgrades in the coming years. And if we were to look now, we're probably looking at about a $30 million investment to bring the stations up to speed. And then if you're looking at replacing the volunteers year over year, to start with, you're looking at another $22 million for salaries and benefits. So it's expensive. It's very expensive. Apologies. And to give you a quick look at what our units cost, you can see that down the center, anywhere from $40,000 to almost $1.2 million for an aerial ladder truck. These units, we do have a long range plan. We manage our fleet. So boats and gators and your average vehicles, we try to get at least 12 years out of them. Our larger units, our pumpers, our ladder trucks, things like that, our tankers, we're looking at a 20-year life cycle. So it's an investment. So that number is not so bad if you look at it over 20 years, but the hard part is paying it, which is what we have to do a lot of as far as raising the money to pay for the equipment. And I use the words volunteer versus career. I'd like to think, and I do think, that we're all professionals out here, whether we're volunteering or whether we're getting a paycheck. But we also do and receive the same exact training as career staff and other jurisdictions. So the entry-level firefighter 1, firefighter 2, you can see the number of hours. That's about a 4-month-long class, which also includes hazmat ops and EVOC, which is the emergency vehicle operation course for those who are driving vehicles. And then on top of that, once you get the basis or the basic requirements and training, there's other levels of training that you need to be able to drive a truck, which basic pump operators, driver operators, aerial operators. And then when you achieve that, you should have enough experience where then if you have the will to become an instructor or desire, and you can see there we have an instructor program and an officer program on top of all of that. When you look at the EMS side, they too have quite a bit of training that they must go through. An EMT class, again, is another 3 to 4 month class, 154 hours worth of training. And then on top of that, you can advance to the next level, which we call our shock trauma levels. And then we have numerous EMTs who are paramedics, and that's roughly a 2-year commitment to obtain that type of certification. So hats off to all those who do that. We certainly rely on them. The community relies on them, and we're very fortunate to have the number of paramedics in our volunteer service. My mouse is going crazy here. Sorry about that. So if I look at our demographics, this is something we're looking at to understand who's in our cadre of volunteers. And as you can see, we look at them in different categories. Across the top are the different stations, and down the left side is the different categories. I'm happy to say that in 2020, we did bring in 83 new members. We're up to 590 volunteers in this community. We have a very diverse group. Culpeper is a diverse community, and our rosters show that, which is good. Supporting members, those who are not able to do the frontline firefighting or EMS type duties, they do support us in many different ways, whether it's in an administrative role, assisting with fundraising. All of this takes a tremendous amount of time, and we're so thankful to have those in our group as well to assist us. Some of the other things that we're looking at, I had mentioned that it is a young man, young woman's game out there. I mean, it's a very, very hard work. We're seeing that our members with less than 5 years of service was up in over 2019. We have volunteers under 40 years of age was up. Key contributors over 60 was up. So everything is looking good. Even in a COVID year, we're very thankful for the community who have stepped up to help us and to keep us a viable volunteer system. One of the last note there, I just want to highlight that we have many career staff who work in Fauquier or Fairfax and Arlington and Prince William who receive a paycheck, who are career fire and EMS trained. And they come back to our community, they live here, and they give back their skills to our community and help us with our efforts locally. So with all that volunteering that's going on, just to keep in mind, we are moms, dads, grandparents, brothers, sisters, aunts, and uncles. We have a life. Some of the backgrounds that our volunteers are, they're business owners, they're self-employed, they're IT professionals, lawyers, healthcare. I mentioned the career fire and EMS guys and girls that we have, construction workers, heavy equipment operators, mechanical, electrical, plumbing, trade volunteers, office specialists, machinists. We have people who work for the government. Thankful for our retirees who still give back to us. And we also have students in school who are junior members in our organization, and they are also on a track to become professionals if that's what their goals are. So this really gives them an opportunity to get a heads up or a jump in preparing to go into the career world. So this is what I really wanted to highlight too, is the lost revenue. As you can see, without bingo, that was 62% of our income. Our carnivals were postponed and our fairs. Donations were a little bit down last year. Our dinners that we do, our events and standbys where we are able to collect some money from the host organization for the standbys that we do. All of this came to a screeching halt, and in 2020 we did lose about $800,000 in volunteer fundraising. So what we said, we needed to stop and look. What we were doing is no longer working. So we needed to assess what we were doing. We needed to be more innovative, and we needed to transform a bit. Our recruitment and retention committee certainly stepped up and helped out, looking how we could do more to reach the public. So our social media had a huge makeover, not only for the association, but for each of the individual departments. We put out brochures. We attend Culpeper Fest. I mentioned the virtual trainings. WJMA has been very good to us. We've done some PSAs with them, public service announcements. We're looking to get a banner across Main Street to remind the community that we are a volunteer fire and EMS organization. We've done some recruitment videos. Thanks to the chamber for the appreciation banquet, Valor Banquet. Again, there was good publicity around that. Our board of supervisors are working or have already delivered some road signage that reminds all our residents and our visitors that we are a volunteer community, fire and EMS. And also the Culpeper Times is also making space for us to tell our story. So the other things that we had to come up with, we're actually doing drive-through chicken dinner. So we prepare the food and then people drive into the parking lot, hand us some cash, and then they walk away with almost a home-cooked meal with spaghetti dinners. We just did an online raffle. One of our organizations did that. They raffled off a gator. So it was very successful. I think we had something like 35 states that actually participated in that, people who bought tickets. We have one company that's doing a drive-in movie a few nights during the summer. Mail-out campaigns are going to increase. We're certainly working on grants. Over the past years, we have received over a couple $1 million in grants, which is a big boost to us. The CARES, we're working with the county on CARES grants. Some departments are doing boot drives. We talk about trail rides where a lot of these activities are outside as we have great social distancing. So we're able to still provide or able to do those. And we just did an online shopping where there's this company that actually has merchandise that they sell. And then we get a percentage of that, whoever the organization is who's in that at this time. They get a bit of a kickback on that. It wasn't very successful this first time around, but we're going to give it a try again. I just wanted to share too, I mentioned the training. I'll go through these a little quick. I know we're pushed for time, but our training is, again, just like the career staff. This is a burn building over in Orange as part of the Fire 1, Fire 2 evolutions. We go into this building, we set fires on the inside. We have instructors that do that. And then we have the students go in and they have certain tasks to perform. And it's a big day. It's an 8 to 10 hour day. A huge amount of resources are committed. These are all the volunteers, the students that are in the class. Our EMS providers are checking our vitals between each evolution. We have someone who's doing the scenario, running it. Just a little bit on the inside of the building. We put straw and pallets in there and set those on fire. Then the firefighters go in and pretend that's a room and contents on fire. They knock down the fire. They do searches, ventilation, those type things. Everything that you would do on a real fire. We monitor the environment. Temperatures in the space get somewhere around 1,000 to 1,200 degrees before alarms go off, and then we have to dampen the fire down to keep it safe. Even forcing a door, we practice that going in. It's like pushing or breaching the front door to get into the house or a building, advancing hose lines, throwing ladders. And here in the bottom, you can see the crew on the inside found a patient. They brought the patient to the window and we're taking them down and we will hand them off to EMS. Going to the roof. And after every incident, we're always asking, is everybody okay? Was anybody hurt? Did we learn something? That's always key. And the key point at the end of the day is everybody gets to go home. I'm sorry for this picture. It's a bit blurry, but this is the latest Fire Academy class. We actually started with 24. We finished with 15. And I'm happy to say that they are all state certified as Firefighter 2 firefighters. And they all did an excellent job going through this class. And I would have to say this is one of the best classes that I've seen come out of this program. So hats off to all of them. And as you can see, there's a bit of youth there. So I'm excited about that. And we look forward to having them in our individual departments and putting them to work. And this class actually had representatives from all 8 departments from Culpeper in it. So that was really good to see as well. With that, if anyone has any questions, I will be happy to take those.
Junior, thank you so much. I just want to say that we at the Chamber respect and really appreciate our partnership that we have with Culpeper County Volunteer Fire and Rescue Association. You guys are doing an amazing job, and we're happy to be able to help you. And hopefully, coming in 2021, that we'll be able to help you guys find more volunteer fundraising efforts. So, please keep working with us. We appreciate it, and thank you for all you do.
Thank you, sir.
And now we'll move to Dr. Tony Brads. Many organizations have had to find new and innovative ways to do business this year, but there may be no better example than the work the Culpeper County Public Schools have done. Losing the end of the school year was a setback no one could have expected at the outset of 2020, but our school system responded with a mitigation plan that put students back in classrooms and provided a virtual option for those that were unable to be in person. Teachers have put in countless hours to help make our students feel comfortable and loved. Administration has worked tirelessly to keep our children safe, and they've built a state-of-the-art career and technical education center in the midst of a pandemic. Joining us today to update us on what the future holds for Culpeper County Public Schools is Superintendent Dr. Tony Brads. Dr. Brads, thank you for joining us.
Thank you, Jeff. Can you hear me okay?
Yes, sir.
Okay, I'll move rapidly through this, but not to the detriment of the participants, because the presentation will be shared and there are many links in that folks can come back to. Jeff, appreciate the opportunity to share in the state of the community. And our theme is going to be CCPS, we're moving forward. We want to share our high five, our top 5 things in a positive way of what we're up to and where we're headed. So that's the theme. I'll get to that. 5 topics I'm going to rapidly cover will be, as has been mentioned earlier, Culpeper Technical Education Center. I want to talk about career opportunities with CCPS because, as Paige said, CCPS is the largest employer in the county, and we contribute greatly to the economy of this county. Our employees do. A quick update on the mitigation plan phase 2, instructional model for the rest of the year, and our summer academy program. So I'm going to hit those things pretty quickly. First thing I want to talk about is the CTE Center, now called Culpeper Technical Education Center. It will be opening this August, and I'm very, very excited to say student registration is underway. Normally, I wouldn't insult folks with trying to show them a website and navigate, but we're so pleased with this website and the information that's there that I'm going to link to that pretty briefly for a couple of points. So going to go there. What should be on your screen is the CCPS website, the main page. Jeff, thumbs up on that. Is that coming through? Let's go back.
Yes, sir.
I want to stop share because I need to check the box that Amy said to check. Let me stop share. Oh, it's still selected. Amy, it was still selected, so that's excellent. So going to the website, what I want to point out on our main page is the trip to our Culpeper Technical Education Center website. And for those participating on this or may view it in the future, please take a look at the awesome photographs that are there based on what's there in the building. So that's one thing I wanted to point out. Also, that registration is underway. I already mentioned that. The top bar talks about course offerings. I'm going to touch on that quickly. Course offerings, it shows the programs that will be at CTEC. You can click on any one of those. Let's click on cosmetology, for example, and it tells you what those courses are. We can go back to course offerings and select any number of programs in that regard. What I'm especially proud of is the fact that we have a tab for planning for CTEC that goes all the way down to 6th grade for students and parents, families to be thinking about, how do I prepare for such a thing? So if I'm interested in cybersecurity, these are the courses. And beginning at 6th grade, this is what I should be taking to get myself prepared for that. So I think staff has done a phenomenal job in showing these kinds of things. So I just wanted to point that out. So trying to get the bar out of my way to put on the side. Okay, so let's go back to the website. We still back to the website, Jeff? A little technical with the popped up, the little pop down menu from Zoom. So I really want to share, this is less than 2 minutes, so it shouldn't eat up too much of our time. I want to share the virtual tour that is on the website for CTEC.
When Culpeper County Public Schools opens in the fall of 2021, there will not only be new courses for students to select, there will be a new school to attend, the Culpeper Technical Education Center. Students enrolled at CTEC will graduate with an industry credential and will be prepared to enter directly into the workforce or to pursue further education and training after high school. CTEC students enroll in 2-year programs that will prepare them for their future careers through hands-on instruction and authentic workplace experiences. Today, you can learn more about the CTEC course offerings by visiting the CTEC website. There, find out, what will you learn at CTEC? What industry credentials will you earn? What is the career outlook for the future? Discover your passion at CTEC. Register to enroll today. Commit to your future.
Okay, if that doesn't give you goosebumps, I don't know what will today on this rainy Wednesday. So I appreciate the time to offer that. The next item that we want to talk about briefly, as a active member of the chamber, the school division is obviously a large employer. Today, I'm not going to read through all those positions, but people kind of sometimes forget there are so many different career paths within the school system, from financial, clerical, secretarial, custodial, food service, teachers, obviously, administrators, coaches, just tons of opportunity there. So with that being said, we're excited about our FY22 budget coming up, that there will be potential for 38 new positions. And we also have, in a normal year, our regular attrition, normal attrition, retirements, and what have you, in terms of reconstituting our workforce each year. A couple of points that I want to make there takes us back to the CCPS website. Jeff, please jump in and tell me if it doesn't do what it's supposed to do. But I want to point out to our viewers and participants and our viewers later that right on the website we can go see what's available in Culpeper County. This is better than Indeed and Monster. It's right here. Come and check us out. We have lots of positions for people to consider. To go back to the site, one I want to point out in particular is coming up soon at the new CTEC building on April 24th. We're hosting a job fair for the positions that are posted there and those that are to be posted. It's an opportunity for folks to come and learn more about those positions. So they're there on our website as well. So again, I apologize for the website tutorial slightly, but it's a phenomenal amount of information about what's coming for Culpeper County Schools in opening this fabulous new school and the opportunity for our students in the community, and also the available for positions in our community. So very excited about that. quickly, in a timely way, the school board just updated our mitigation plan from the summer. Yes, the school board gave administration to make updates based on any executive orders from the governor. So some of the main things were to incorporate some of those changes. But the full plan, which I will not click on, is there listed. The plan document link that was approved by the school board this past Monday night is there. But key updates to that plan addresses something that when we contemplated this mitigation plan, the notion of vaccination clinics, that really wasn't on our radar just yet. And with the help of our community partners, as Ms. Staten talked about, our hospital, our local health department, it's just been a phenomenal collaboration to get vaccinations in arms of staff members. And you've heard some of those numbers. It's just been phenomenal. We are at 85% plus efficacy for our staff in terms of having the vaccine. Hope to get a few more. And part of our plan is to move forward with developing an opportunity in the future for eligible students, parents, guardians, and caregivers of students to be vaccinated. So we're excited about that. Another part of mitigation plan change will be going from the 6 feet of mitigation down to 3 feet of mitigation. That's very wordy. I will not read all that, but that's essentially what the first paragraph there talks about. The second paragraph is not new to our plan. We implemented it, but it was not written in the plan per se, so we memorialized it. But frankly, it's one of the things that kept us going tremendously, and that was our clinic staff, clinic assistants, and our nurses and office staff contacting parents when students were out ill to find out what were those reasons so that students did not come to school sick. We have not had a student-to-student or a student-athlete transmission of COVID-19 in our schools all year. And we attribute that to the hard work of our staff and certainly to the adherence of the mitigation plan, but also to our parents for not sending children to school sick. So it's been pretty phenomenal. A couple other things in the mitigation plan. Yes, masks will continue to be worn, and some of those gathering limits were just addressed by the governor with some things to take effect on April 1st. Won't go into that, but we do adhere to the executive orders as they come through, but masks are still a mandated item. Not so much a part of the revised mitigation plan from Monday night, but just to touch base on this with our audience. The mitigation athletics, we've been pursuant to our mitigation plan, a slightly different one, and separate for athletics. We've been conducting out-of-season workouts since June, and subsequently with the executive order permitting it and the VHSL sanctioning it, we have been doing VHSL competition since December. The schedule was changed slightly and compressed. Winter sports occurred essentially in the winter. Fall sports are occurring at the latter part of winter, early spring, so they're about to wrap up now. And then we'll finish up with the compressed spring sports season in more of a traditional springtime time frame. We're excited about that. And as I mentioned, although we've had some teams quarantined because of close contact, we've not had a student athlete or student direct contact or transmission of COVID-19. Very proud of that. So other great news moving forward. On Monday night, the school board approved, effective after our spring break, which is Monday the 12th, that we are going to maintain our current 2-day in-person model, a hybrid model for our elementary schools. We've done a great job getting students into those A and B cohorts, but because of space with 3-foot distancing, we could not get track C students, remote learners, into those in-person tracks. So this will enable a lot of students that are on the wait list and families who want to do that to do so at the elementary level. And a handful of students that were already on track D 4 days a week, that will continue. And of course, remote learning will remain an option for track C. A change shifting to, after spring break, a 4-day in-person model by combining our track A and B students, that's our in-person students that are hybrid, and permit adding a track C students, the remote students, if space is available. Remote learning remains an option, and track D students will remain on track for that as well. Last but not least, talking quickly about instructional recovery and our efforts to look at that as we move from a 4-day delivery system to a 5-day delivery system in the fall, hopefully. We intend on conducting a summer school that will be 4 days a week, Monday through Thursday, 8 a.m. to 1 p.m. And the dates are there. The Elementary Summer Academy, specifically targeted for those areas and students who need to be reporting for those things. Transportation, breakfast, and lunch will be provided. Additionally, we'll be offering a robust program for our secondary students. And certainly we are, as other presenters have talked about, funds available. This is happening because of the CARES funds that we were able to do, the extension and of these summer academies and instructional therapy for our students, elementary and secondary. We see how the secondary schedule plays out there. So Jeff, that was fast and furious, but we're moving ahead with the school division. We're very excited. It's a great time for us, and we're hopeful that we're turning the corner, so to speak, with the help of our community partners, due to vaccinations, due to some lessening of mitigation and those kinds of things, so that we can move forward, certainly in a safe fashion, but to get our students back in person, because we believe that our students learn best in person. Thank you, Jeff, for this opportunity. Be happy to answer any questions if need be.
Thank you, Dr. Brads. Again, we appreciate all the information you're sharing and everything the Culpeper County schools are doing to be able to help educate our children. Moving forward, today speaking about infrastructure in Culpeper is John Egerton, Culpeper County Administrator. John, thank you for joining us today.
Good morning, everybody. It's a pleasure to be here, an honor to have been asked to follow those very fine 4 speakers that preceded me. So I've learned a lot today, and hope everybody else has too. I have a short presentation. I think it's a mere 8 slides, so I may be able to get us close to back on track. And I will go to share my screen right now. Okay, how's that look for everybody? So I've had the pleasure of working with probably most of the people on this call for a long, long time, but just in case there's anybody who I haven't had the pleasure of meeting, I just wanted to introduce myself briefly. I'm the county administrator, position I've been in for about 5 years. I was the county's planning director for 25 years before that. Grew up in Alexandria, went to school at UVA. I'm married 30 years to a beautiful wife, and I have one daughter who inexplicably went to Virginia Tech instead of UVA. But in any case, it's been a wonderful place to be here in Culpeper and have a career and raise a family. So I feel very fortunate. I know I'm supposed to talk about infrastructure, but I did want to talk about just a couple of 2020 highlights here. The biggest challenge, of course, in Culpeper was responding to COVID-19. And for the local government, the initial challenge was acquiring PPE for our frontline employees and shifting people around to work remotely and really just having to adapt our operations. So it's been an experience. And of course, the lack of high-speed internet for many of our residents became one of the focal points of the pandemic. It was a problem long before the pandemic, but really things have shown a spotlight on that issue. And so that's going to be a focus of some of the slides you'll see today from my presentation. But a couple of success stories that I want to mention before we move on. Culpeper Human Services and Kids Central were able to partner very quickly at the beginning of the pandemic and work with the school system and create a daycare program for our frontline employees. And that, I think, was an example of what we've heard throughout this day, which is the community has pulled together and worked together in partnership so well that I'm really proud of how we've handled the crisis that we're in. Our registrar oversaw the largest election in Culpeper history with 78% voter turnout. He did that in his existing offices and shuffled people in and out with all the early voting, et cetera, and did an amazing job. We provided about $1.7 million in CARES Act funds, and that's combined with also town money that took us over $3 million for all our county and town businesses. And we also implemented a relief program to provide some, I guess I can call them stimulus checks to families that qualified that had been impacted by having to either quit their job to stay home with kids or cut their hours, that sort of thing, during this crisis. So again, just wanted to talk a little bit about the successes we've had in this strange year. Moving on to the broadband issue, that is obviously a critical piece of infrastructure. First thing I wanted to tell you about is that in addition to all the CARES funds that we got for businesses and PPE and all the many other things, we also had an opportunity to apply for something called Fast Track CARES Act broadband funding. And we were one of a handful of communities in the Commonwealth that were able to succeed with that request, and we got just shy of $1 million. And what we were able to do with that $1 million was serve 4 new neighborhoods in the county with Comcast infrastructure. We began with a subdivision called Culpeper Lakes. That came to the budget, so we ended up serving 3 more neighborhoods and ended up serving about 90 homes with about half that money. The other half went to a wireless deployment on a tower in the Atlantis area, just north of 29, north of Brandy Station. And that deployment will be able to serve as many as 200 homes should they all decide to subscribe to that service. We still had a bit left at the end of that, and the board is ponying up some money of its own to match. And we're going to be able to run a fiber line to the Carver Center down Route 15. So for those of you familiar with Carver, we have a welding school there, a machine shop school. The extension offices are planning to move there. It's a great location, and of course, fiber is critical to its future. So all that was done with those Fast Track CARES Act funds, and we were pretty proud of that. Another effort in the area of broadband speaks to hotspots. We were able to establish 14 public Wi-Fi locations that were established very quickly in partnership with the Culpeper County Schools. I want to mention just one success story with these hotspot locations. One of the places that we partnered was with the Culpeper County Library, providing the hotspot, and then getting with the fire and rescue. And then partnered with the schools to provide a community Wi-Fi location with a para-educator to support the offerings there each week. So there's just another great example with fire and rescue volunteers, schools, library, county, everybody making things happen to try and provide this critical service. So in terms of the big picture for broadband and internet, we did a study with a company called All Points Broadband. We learned through that study that we believe we have about 4,300 homes in the county that are insufficiently served. The board considered a wireless deployment to try to reach about 3,800 of those homes in a fairly quick manner. But in the end, the decision was made to, in light of the changing landscape, there's more and more electrical providers getting in the business. And so we're going to continue down the path of getting that fiber to each home throughout the county. That is really the goal. And the increased opportunities that are coming along are significant. The state's announced there will be $50 million in Virginia Telecommunications Initiative or VATI grants for this coming year. And we believe that we'll be in a great position to compete for, in the millions of dollars to begin laying that fiber to the home and fully serving Culpeper County. And yes, one thing I would just mention again with regard to the fact that we looked at a wireless deployment and then went away from that idea was simply that, when it comes to state and federal grant funding, there's a lot that hinges on the definition of the word served. And sometimes by providing that wireless service, you can cut yourself out of the ability to get funds for the fiber. So I think that the board is fully focused on solving this problem, and I think that within the next 2 to 3 years, it will be solved, and changes you'll start to see much sooner than that. Different type of infrastructure, a couple things in our Parks and Recreation area. At the sports complex, we are installing a new playground that is being paid for by grants and also by private donations. If any of you have ever heard of the Bright Spot Playground, that was installed at the complex and was to allow for some handicap access as well as normal play. And that playground is packed at all times. There's a need for more of that type of thing at the complex, as you have families out there with kids playing sports, youth sports leagues, and maybe their siblings need a place to be. So that playground is underway. And also at the sports complex, the board is exploring and is moving forward, I believe, with a field house. So we're going to build a structure at the complex out there that will have a full-size basketball court that can accommodate pickleball, volleyball, etc. It'll have classrooms for our Parks and Rec programming, and it'll have offices for our Parks and Rec department. And we believe that that's going to be a wonderful facility for the county, and look forward to seeing that happen over the course of the next year. And then lastly, still staying at the complex, we hope to provide the funding this year in the upcoming budget to light the fields. The fields are in high demand. There's a need for more fields, but there's certainly a need for the lighting to allow them to be used for a longer period of time. So that's an exciting development, and we think we're really making some strides in the area of Parks and Rec. Real quickly, in terms of other types of infrastructure, of course, there's always road needs in the county. There's a critical need for a lot of roads to be paved and upkeep, et cetera. And it seems that VDOT is always challenged with their funding stream and how they get that done. But one project that VDOT has funded, and I take no credit for this, this is a town project, but we're going to have a traffic circle at Route 3 and McDevitt Drive, and that in that area. Also, revenue sharing is something the board contributes funds to every year, and that's a matching program with VDOT. Unfortunately, 6 projects we had funded, they remain funded, but their implementation now, based on state limitations, has been delayed about 2 or 3 years. So we've gotten a hiccup in our road paving efforts, but continue to push that. Out at our airport, a few exciting things. Comcast extended fiber out there finally, so we have a lot better service there, which can potentially draw more economic development. In that realm, we've succeeded in attracting PHI, known as Air Care, and they're going to be locating a helicopter at the airport for medical transport. That's tremendous for us because they'll buy a lot of gas, but more importantly, they'll be right here in our community. And should any of us have the misfortune to need a helicopter ride to be air transported, it'll be a lot faster turnaround having them here at Culpeper. So we're excited about that. We're studying different issues with regard to rail in the county for industrial uses, and a lot going on. So I'm probably bringing us close to back on time here. I know that's been a quick run through a few infrastructure items, Jeff, but hopefully that was informative. And I end with this last slide again, thanking you for the opportunity to speak, and just reminding everybody again that it's the team, it's the partnerships, it's the community that's made us succeed, and just so happy to be in this community.
John, thank you. And there was something you said in your first slide, and that was simply, I love Culpeper. And I think that's something that is the binding force among everybody here today, those that are on the call, our panelists, that we all love Culpeper and we want Culpeper to thrive. There is, and I've said this numerous times, there is no place as unique as Culpeper. The way that we are able to partner and team and be able to put our teamwork to practice, John, I think has been seen during this pandemic, that we have really come together and we've shown that we are stronger together. And I thank you and the county and the town for continuing to improve our community and be able to look for ways to improve our infrastructure. So thank you, John, for that wonderful look back at what we're doing and look forward to how we're going to continue to improve Culpeper. And I want to thank all of our panelists that joined us today. This was extremely informative. Hopefully our community really enjoyed it. I've certainly learned things. I hope everybody else did as well. I would like to thank our sponsors once again, Bingham & Taylor, Culpeper Star Exponent, NextEra Energy Resources, and Windstar Technologies. Thank you to these sponsors, and we are able to continue and educate our community. Once again, thank you everyone for joining us. Thank you to our panelists for being able to educate and inform and let our community know about important activities and ventures in our community. And it shows that we truly are stronger together, that when we are able to put everything aside and we are able to partner and work together, we will make Culpeper a better place to live. Thank you. Have a great day.